by making sure you have an order for your cap change. So you can check your doctor's order, and it says that you're going to go ahead and do all 3 ports on your central line. So after I have my order, then I'm going to go down and I'm going to gather my supplies. So your supply list is here. So you're going to need 3 10 cc milliliters normal saline syringes, and you're going to need 3 caps to change. And it has on there that it calls for alcohol pads, but actually you do not need to use the alcohol. They're kind of there just in case if once you put on your new one, if you would bump it or if you would be injecting any medicine into it. But because all you're doing is removing the dirty and putting on the clean, you don't need to clean the dirty one, okay? Does that make sense? So that's why they're there. They're kind of just in case. We don't use, is the heparin still on the list there? Okay, the heparin you can cross out. We don't use heparin anymore. And then you'll need disposable gloves, and you'll need a disposable mask, okay? So this is the way I start off every checkoff. This way you don't forget. I kind of visualize myself walking into the room. So I'm gonna knock, knock. Hello, my name is Shelly Schumann. I'm your nurse today, and I have a doctor's order to change the caps on your central line. So I check my patient, to identify as patient, date of birth, and then I'm going to check for allergies. Particularly when you're doing anything with your central line, you're looking for an allergy to betadine, okay? Which I always ask them, because a lot of times I ask if they're allergic to betadine or iodine. Iodine is what is used in betadine. People don't always know that correlation. I also ask if they're allergic to shellfish, because it's the iodine in the shellfish that creates the allergy, okay? So I ask them, do you have an allergy to betadine or iodine or shellfish? No, okay, so we're good. So I'm going to go ahead and bring my stuff over here. Cap change. So I'm going to go ahead and prep. You're only going to inject 3 cc's of normal saline. Okay, so I just dispose of the 7. Okay, and I'm going to prime the cap here so there's not any air that's left inside the tubing. So I'm going to take my, you don't want to touch the cap, okay? So you're just going to take your syringe and you're going to attach it. And then you can kind of see, you want to see the actual saline go through the top there. Okay, and that makes sure that you don't have any air that's left inside. And then I just set it back inside the wrapper. Some of these are, like, the way you open them are kind of upside down, so. Okay, I'll prime the second one. Again, I'm just going to flip it around so the cap is where the opening is. Alright, and make sure that my bedside table is clean and clear. A lot of patients like to leave food or urinals and all that kind of stuff on their table, so you want to make sure everything's nice and clean. I work at a good working condition, so if you need to move the bed up so you're not leaning over, I come over and I explain to the patient that, Mr. Smith, I'm going to remove all these old caps and I'm going to replace them with new caps. When I remove them, I'm going to have you turn your head away to the left, and you're going to have to hold your breath for a couple seconds when I change each individual one. Okay, so I've explained the procedure. I'm going to go ahead and I did forget to mention, anytime I'm walking into the patient's room, you know, you're foaming in, washing your hands as soon as you walk in, so you're starting with clean hands. Okay, anytime you're working with the central line, you're going to wear a mask. Okay, so put on the mask. And then I'm going to remove the pillow. Removing the pillow just helps so that air does not get into the line as you're changing the cap, okay? So, can everybody see here? All right, so I've got my 3. I'm assessing my site. I want to make sure that all my caps or all my lines are clamped, okay? Because if you would open up to remove the cap and it was not clamped, blood could just flow out freely, okay? So it's very, very important that they're all clamped. You're just kind of looking at everything. The dressing is intact. Everything looks normal. I don't see anything unusual. So I'm going to go ahead and let me make sure here. I'm going to have the patient turn their head away from the central line, and I'm going to, let's see here, make sure. Okay, so I'm ready. I'm going to take my first one. Okay, Mr. Smith, I'm going to have you hold your breath on the count of 3. 1, 2, 3. Okay, you can go ahead and breathe. So now that I've got it attached, I'm going to unclamp it. And I'm just going to pull back a little bit. And you're looking for blood to return in the tubing. You don't want it to go all the way back into the syringe. You just want to see enough in the line to see whether the line is open and patent. Okay, so you're going to pull back a little bit. I see blood return, so now I'm going to go ahead and I'm going to push pause for 2.5 cc's, and then as you're pushing the last 0.5, you're going to start clamping as you're pushing, and that creates like a positive pressure, okay, in the line. So I'm going to do push pause, push pause, push pause, so now I'm at the 0.5, and so I'm going to clamp as I'm pushing, okay. All right, so I set that one to the side. All right, I'm getting ready to do the next cap. Have that ready. Okay, Mr. Smith, I need you to hold your breath. 1, 2, 3. You remove the cap, place the second one on. Okay, you're okay to breathe again, so I'm going to unclamp. Again, you're going to pull back just to look for blood return. Once you see it, sometimes you don't always. I'll go through some of that at the end. Then I'm going to do, again, 2.5, push, pause, push, pause, push, pause. The last 0.5, I'm going to push as I'm clamping. Okay, and then we're going to do the third cap. Okay, Mr. Smith, again, I need you to hold your breath on the count of 3. 1, 2, 3. Okay, you can go ahead and breathe again. So I'm going to unclamp, check for blood return. Then I'm going to do the 2.5, push, pause, push, pause, push, pause, 0.5. I'm going to push as I'm clamping. Okay. And that's all you'll do for the cap change. Make sure all my lines are clamped. And then I'm going to go ahead and sit the patient back up. All right, and that's it for the cap change, okay? So let me go over a few things with that. For checkoffs, you're only going to do, you can go ahead and stop.